clinical trial to look at HIV-associated neurocognitive disorders. This video was created by the Case Western Reserve University Hospital's AIDS Clinical Trials Unit. Please feel free to contact us about this or any other trial on our confidential telephone line 216-844-4444 or email us confidentially at info@case.edu. We know that anti-HIV medicines work to control a person's HIV viral load, or the amount of HIV in the blood. This is very important in allowing HIV-positive people to stay healthy. But we also know, as important as it is to keep the viral load very low, this does not resolve all of the health issues for HIV-positive people. One of the issues that remains for some HIV-positive people, even when their viral load is undetectable, is something called HIV-Associated Neurocognitive Disorder, or HAND. So what is HAND? Let's break it down. If something is HIV-associated, that means that an HIV-positive person is more likely to experience the condition than an HIV-negative person with the same characteristic. The word neurocognitive has two parts. The first, neuro, means a person's nerves or nervous system. The second part, cognition, is often thought of as thinking skills, such as attention, memory, language, decision-making, and problem-solving. A disorder in neurocognitive skills could result in a range of symptoms, including confusion, forgetfulness, behavior changes, and headaches. It is important to know that some people who have mild HAND may not notice any symptoms at all. So, what causes HAND? As with many other things about HIV, we are still not sure. However, through research, we can learn a lot more. Many researchers believe that one cause of HAND involves the HIV in the central nervous system. Many anti-HIV medicines that control HIV in the blood don't get well into the central nervous system. Researchers believe that insufficient control of HIV in the central nervous system causes inflammation that leads to an impairment of a person's neuro and cognitive skills. The AIDS Clinical Trials Unit at Case Western Reserve University Hospital's Cleveland Medical Center is currently enrolling HIV-positive people into a clinical trial to see if one strategy can help people with HAND. The trial is happening in Cleveland and other research sites around the country through the AIDS Clinical Trials Group, funded by the National Institutes of Health. The purpose of the study is to see if adding extra anti-HIV medicines that do get into the central nervous system will control the HIV it finds there, reducing inflammation and helping people with HAND. These two medicines, Maraviroc and Dolutegravir, are approved by the United States Food and Drug Administration for the treatment of HIV infection. Unlike other anti-HIV medicines, both Maraviroc and Dolutegravir do go into the central nervous systems at levels thought to be effective in controlling HIV. Like all clinical trials, for this trial we are looking for a certain group of people. We are looking for people living with HIV at least 18 years of age, on current anti-HIV medicines for at least 12 months, have an undetectable viral load, and do not currently have hepatitis C. Also, we are looking for people who do not have any other medical condition not related to HIV that may cause cognitive impairment or thinking problems. To be eligible, people must never have used either Maraviroc or any other type of anti-HIV medicine called an integrase inhibitor. This includes not being able to use these commonly used anti-HIV medicines: Genvoya, Icentrus, Stribild, Tivicay, Triumec, and Vitecta. People who enroll in the trial must have at least a mild case of hand. Remember that some people with mild hand might not even know it. People who are interested in joining the trial will be tested for hand through several neurocognitive tests. These tests are like puzzles or memory games where people are asked to do simple tasks. So, how does this trial work? First, it is important to know that this trial is placebo-controlled. That means that instead of getting the active trial medicines, some people will get placebo pills. A placebo pill looks like the real medicine but does not have any active medicine in it. Some people know it as a sugar pill. People joining the trial will not know if they are taking a placebo pill or the real medicine until after the trial is over. Participants will be randomly, like with a flip of a coin, put in one of three groups. A group that adds both of the real medicines, Maraviroc and Dolutegravir, to their current medicines. A group that adds Dolutegravir and a placebo for Maraviroc to their current medicines. And a group that will add placebos for both Maraviroc and for Dolutegravir to their current medicines. The clinical trial lasts 96 weeks, which is almost 2 years. During this time, there will be 10 clinic visits, which includes the screening visit, where we check to see if a potential participant is eligible to join the trial. Neurocognitive testing will be done during the screening visit and every 6 months afterwards. Compensation is provided per clinic visit. You do not need to be a patient at university hospitals to join this trial. If you have any questions, please feel free to contact us. We can be reached through our confidential telephone line 216-844-4444 or at info@case.edu. People are not under any obligation to join a study simply because they ask questions. We will also be happy to talk with your doctor and answer any of her or his questions. Additionally, if you would like, we will share any laboratory reports with your doctor and you during the trial. Additional information is available at our website, clevelandhiv.org. And don't forget to follow us on Facebook at CWRU AIDS Clinical Trials Unit. Thank you.